Hello everyone, greetings. This is Shagorika Ray from San Diego, California. Thank you for having me to your national webinar, The Nursing Today and Beyond. First of all, I'd like to take a moment to thank Anamika Di, who has extended this invitation. Also, I want to say thanks to Dr. Nuranha for this opportunity, and most importantly, thanks to all the nurses from Manipal College of Nursing who are with me today and listening to this case management nursing path. I hope you all had a wonderful Nurses Day, International Nurses Day, Nurses Week. We do take pride as nurses, what we do every day, serving patients, serving community, and try to make a difference. So thanks to all the nurses out there, all the wonderful nurses out there that do such a great job. Just to share a little bit of my background, I have been practicing nursing for more than 21 years. I was born and raised in Andaman Nicobar Island in India, a very remote place where we did not have access to a lot of resources, especially healthcare. I was fortunate enough to pursue my nursing degree from West Bengal College of Nursing from 1996 to 2000. After that, I got married, moved to Delhi, stayed there for a couple of years, and moved to United States in 2005 with my family. After moving to United States in 2005, I started working as a bedside nurse in a long-term acute care hospital and made my way up to different leadership and management roles and moved to case management in 2013. Since then, I have been practicing as a case manager and I have performed in different capacities and different roles. While doing case management, I also pursued my MSN and MBA in 2013. All right, so now let's see what is case management. Without further delay, I like to take you to the case management world with the definition and just to talk about what is case management. Case management is unique and full of collaboration and coordination towards patient-safe discharge planning with proper utilization of resources and optimized quality of patient care. So the American Case Management Association has also defined the case management is in their own ways, and they have said case management is a collaborative process of assessment, planning, facilitation, care coordination, evaluation, and advocacy of options and services to meet an individual's and family comprehensive health needs through communication and available resources to promote patient safety, quality of care, and cost-effective outcomes. So in this definition, there is so many terms that you probably have to understand. Let's break it down in a very simpler version. So in a very simpler term, the case management has the objective to provide the patient care coordination with the collaboration with different departments that could be social services or interdisciplinary clinical team members, meaning the doctors, nurses, therapists, pharmacists, everybody that they are actually involved with the patient care, utilizing everyone's expertise and resources and combine them together towards a safe discharge planning. So that way the patient can get the quality of care and they don't stay in the hospital's length of stay is lower, and we can also make sure that the cost is not high. So if you're not familiar with the US healthcare system, I can just talk about a little bit, or you may be familiar with the US healthcare system. As we all know that the US healthcare system is really broken and the healthcare cost is always increasing with the poor patient care quality. However, even though the US has the highest healthcare cost and healthcare cost is very expensive, but there are some positives also US has. For example, US healthcare is always accessible to everyone. If a patient walks into the emergency department, we cannot deny any care to a patient regardless of their financial status, if they have insurance or not, we are still expected to provide the full care that they may have come in for. So we cannot deny them. Also, the wait time in terms of the patients or the clients, if they need the health care, they need procedures or any type of special services, they do not have to wait, they can get it right away. So there are a few things that obviously the US health care system has the positives, even though they have large negative points. All right, everyone, let's now talk about the case management scope of service, or case management scope of practice. So scope of case management is really huge, but we can just probably talk about some of the broad points. So some of the broad points in scope of case management encompasses education, care coordination, compliance, transition management, and utilization management. So let's see what is in education. So education is the most important tool. We have to see the patient as soon as they are admitted to the hospital. We meet with the patient, our education begins from there. We evaluate what social support they have, what's their prior functional level, are they using any equipment, will they need any type of equipment, what is their medication access, who are their primary care doctors, what are the special services they're receiving, are they going to the doctors, are they seeing their doctors regularly, things like that. So we evaluate everything and we start education as soon as we identify there is a need for education. We educate doctors. We make sure that the doctors are writing the orders appropriately. They are writing the level of care appropriately, because in the end, we will need to send those documents to the insurance company and they will be the one reimbursing hospital. So it is imperative for us to be available and make sure that we are educating every discipline that they are involved with patient care, and everybody is putting their notes in the chart appropriately. So education has to go on from the admission to discharge, and it continues even after patients are discharged. Secondly, care coordination. So care coordination, as I have been talking about care coordination all along, we have to connect with every department. We have to collaborate every discipline to make sure that we are coordinating everything for the patient. Whatever maybe the patient need, a simple need maybe, patient may need a walker. What I do at that time, I will be coordinating that walker arrangement for the patient. I would have to make sure that there is a doctor's order, the order has been sent to the durable medical equipment company, and the walker is available to the patient before they are discharged. So the care coordination is huge. Again, we have to continue to just coordinate everything until the patient is safely discharged. Compliance is the third scope that we have. Patients, they have rights regardless of everything, regardless of funding, regardless of their any other status. They have rights. Patient can refuse the care, they can accept the care. We are patient's advocate. Case managers are the advocate for the patient at every level. We have to offer them choices, we have to offer them options, and they pick and choose. We are there to maintain. Patient right is always maintained, and we advocate for them. Whether we can make things happen or not, whether we can provide what they need, but we still have to continue to advocate for them throughout. Medicare is a regulatory agency here in the United States. Medicare is big. They make sure that they pay hospital for the care that patient gets through Medicare program, and they want to make sure that the hospital is providing the quality of care and they are providing everything that the patients they do qualify and they deserve. So patient right is huge, and we have to maintain that at all time. Transition management. Transition management, again, it is mostly making sure that we have the appropriate level of care as soon as the patient comes into the hospital. We also have to make sure that we do transition patient to the level of care appropriate or applicable to the patient's need. For example, when patient comes for a stroke, for example, they probably have got admitted for a stroke. We have treated them. Now they are probably needing some type of rehab, that may be acute rehab or a skilled nursing facility rehab. Under those circumstances, we have to meet with the patient, we have to offer them choices, and we have to connect with these skilled nursing facilities, send them referrals, have them evaluate, have them make sure that they can accommodate the patient's current level of care. If the patient is a managed care patient, we have to get the insurance authorization, making sure that the hospital has reimbursement in place. Also, patient is getting reimbursed for going to a rehab for further care. So transition management is huge. We again maintaining patient right. We're making sure that the level of care is appropriate and patients are discharged early as soon as possible, so they are not staying in the hospital, minimizing length of stay, and patients' overall care is safe, and we have a very good and safe discharge plan. The next scope is utilization review. Utilization review is the other part of the case management, where the utilization nurses make sure that we have appropriate level of care. The doctors have to make sure that they have a good history and physical written, capturing all the clinical documentation appropriate for the patient's inpatient hospital stay and the admission, because in the end, insurance will review the notes and they will determine if the patient met inpatient criteria or they were observation, all of that, to make sure that hospital has appropriate level of care and payment in place. So utilization review management is also a huge piece. In my hospital, we are triad model, meaning our department has 3 segments. We have social services, we have transition planners, and we have utilization review nurses. So I do primarily work in transition planning area, and I do provide services with the care coordination primarily. I hope that this was not too much information and you probably have grasped a little bit of the scope and the fun part of the case management. All right, so I think we have talked about case management a lot in terms of it's fun, it's exciting, and they are typically a problem solver every day. And sometimes people think that case managers are magicians, but they're not magicians. They're just like hardworking people like everybody else, and they don't know how to give up. So we also have many challenges like any other nursing career field, case managers as case managers. So the first one is, I think, the staff shortage. Staff shortage is an everyday issue. We do not have enough staffing, so our caseload can be really high. American Case Management Association, our national organization, stated that patient care ratio with case managers should be 1:22. However, in reality, we do have caseloads could be ranging from 40 to 50 in inpatient hospital setting. Is patients making sure they have everything they need to have a safe discharge plan towards the transition plan that could be going home or going to lower level of care, skilled nursing facility, board and care, independent living, so and so. So staff shortages are huge. Secondly, also dealing with different type of personalities every day could be overwhelming time to time. Doctors, nurses, therapists, pharmacists, this all people, they're all different, and we all have to make sure that everybody is functioning in a very cohesive manner, which is not easy. So we have to really keep that goal all the time to make sure that we are keeping everybody on the same page, working together cohesively, and we do have a safe discharge plan for our patient. And also the other challenges are associated with the patient care population and the complexity of the care. In US healthcare, everybody has the right to get the care. If they show up to the emergency department, they cannot be denied, and they have to get the health care they need, regardless they have insurance or not. So what happens many of the time when they come to the hospital, they do not have insurance, they have substance abuse problems, they are alcoholic, they do not have good support system. It could be a real challenge for us to come up with a safe discharge plan. They can stay in the hospital for a long time, and which is not good for the hospital because, again, higher the length of a stay in the hospital, healthcare again is very expensive, and our goal is constantly we're working through keeping the patient's length of stay lower, work through the utilization review and try to keep the cost lower and try to get the patient discharged safely. So you can only imagine when they come with no insurance, no access, no support. So making safe discharge plan could be really challenging. So again, case managers are not magicians, but they have to figure out how to get those resources to them so they can go home if they're homeless. So they have to work with the social workers to make sure that they have still a safe discharge planning that could be going back to shelter, or if there is no beds in shelters, they have to make sure that if they're going back on the street, they still have clothes and they are being given some food. So these are some of the big challenges that we do face in our day-to-day operation, which is not fun, but it is what it is. I wish my session was more interactive with you all today. Unfortunately, this is kind of not very interactive, but I'm trying to make it more interactive. I want you to know that I will be available, with any questions or any messages that you would want to share with me. You can always send it to me at my Gmail, my first name dot last name at gmail.com. All right, now let's take you to the most exciting part, which is why case management, why I do case management, why I do recommend you do case management. There are some great advantages of this career path that I like to share with you today. First and foremost, I think we do such a great job. You help a patient who may have come into the hospital, did not have any resources, did not have any help, and you're able to provide that resource for that patient in the end, and that gives you such a great satisfaction that it feels like really a great motivation and rewarding service opportunity. So you definitely enjoy that part. Secondly, it has great compensation. You're working, but you're not working too hard. I mean, bedside is always hard. We have done that, we know that, and it is definitely very hard to do bedside forever. So this could be a very great option to us. And the other great option that personally to me was to balance the professional growth and to have a great family life. This was a great option to me and I chose it. If you do, you'll never disappoint yourself. So please try that. The other things that I can talk about, you'll have a more balanced shift, meaning you're not gonna work 3 shifts, or you will work like Monday through Friday, weekends off, because most of the operation happens during business work hours. So it's typically more business work hours type of model. So you'll enjoy it more. So try it. All right, folks, now let's talk about scope of case management in abroad versus India. Tell you the truth, I don't have much experience and knowledge of case management in India in particular, but what I hear and what I see, it's going on. India is always emerging, always evolving, always very competitive in every aspect. So case management is not so far. It is going to be there very soon, and people will have tons of need for case management, and it will be there before you even know it. So just get prepared. It's coming sometime. But in abroad, I can talk about case management is the opportunity a ton, because the system in healthcare system, there is broadly 4 type of healthcare system that we are aware of primarily, and they are all mostly available in abroad. The types that we are familiar with are Beveridge model, Bismarck model, National Health Insurance or single payer model, and out-of-pocket model. So India has most likely the out-of-pocket model, which is very expensive. Some people, they may have some insurance through their employee, but there is no checks and balances. There is no case management. So whatever the doctor tells or the hospital provides the amount that the patient is responsible for payment, insurance just pays for it. So there is no checks, there is no balances, there is no case management services that they have available for them to make sure that the patient has received those care and they were kept appropriately in a level of care based on their medical necessity. So again, we don't know for sure what happened there. So patient may get charged overly and they may not have had the care that they needed. So it is coming, it is going to be there sometime in India as well. But in abroad, like in US, case management is a basic necessity now. Healthcare cost is increasing. We just have to make sure that the patients are not staying in the hospital for longer than they need. There is appropriate utilization of services, not underutilization, not overutilization. So there is a lot of balancing act which is offered by the case management only. Patients should not be discharged so quickly that they are readmitted. When they are readmitted, hospital gets penalized. They don't get paid. They only get paid just as lump sum amount if patient is Medicare, and Medicare is the most largest healthcare insurance that we have here in the United States. So we depend on Medicare. So so case management, they are the keeper of making sure that they are not discharging patient too early or they are not staying here a long time. So the cost again goes higher. So there is a lot of responsibility that case management they have in general. They have to justify if they are staying in the hospital, why they are staying in the hospital. They are talking to the doctor, what is the barrier for discharge? If the patient is ready to go to a next level of care, what would be the need? So the doctors, they have to justify to the case management when we are asking them to justify. So we do a lot of work, tons of work, and abroad is always going to need that because of the fact that the healthcare that they have currently, they solely depend on the case management services and their assistance and their help. So we can probably talk about this forever, and I wish I was there to take your questions today, but unfortunately I'm not there in person. And again, thank you for having me today in your national webinar, the Nursing Today and Beyond. It has been my pleasure to be with you today. Have a wonderful time. And just so again wrap up, I do know that your segment is from the psychiatric nursing area, and in case management, I just want to emphasize that case management has a specific service area where we have psychosocial need, and we have preferences for the psychiatric nurses and social services. Whoever is they have the experience in psych nursing, they get the preference. So they are very appropriate for case management services because our service includes not only the medical services, it also has psychosocial services along with it, because we have tons of those type of patients. They need mental health services and substance abuse, disabled patients. So we have to cover each area. So it's not only limited to the medical nursing area. So I encourage for you folks to consider this case management. This would be a great opportunity for all psychiatric unit as well. Thank you. Take care. Pleasure being with you today, and have a wonderful time. Thank you again.